Good afternoon. I'm Professor Andrew Chilton and I'm the Medical Director at Kettering General Hospital Foundation Trust. We've had a fantastic response to the COVID vaccine. However, the response hasn't been uniform, and we know that some communities the uptake has been less than in other areas. So today I'm joined by a number of friends and colleagues, all who've had the vaccine, who are going to talk to you about their experience and why you should have the vaccination done. Thank you. I'm joined by a friend and a very respected colleague today, that's Dr Fayyaz Hussain. Fayyaz, tell us a little bit about your clinical background and your personal background.
Hi, thank you, Andrew. So I'm Fayyaz Hussain. I'm a respiratory consultant. I'm born in Pakistan and I've been trained in UK, and I've been in UK for a long time. So that's my background, working in UK, but I've also worked in Pakistan and in Canada.
Right. Fayyaz, what professional impact has this disease had?
So professionally, we have seen patients being admitted on a daily basis to the wards, to intensive care, and sadly dying. At a personal level, we have seen virtually every member of the community being affected. Either their friends or the families, they got the infection, they've been ill for some time, and again, either being admitted or have died, and sadly they're not being even able to attend the funeral or attend them while they're in the hospital. I get telephone calls from all over the world from Pakistani community asking about the disease and asking about the vaccine.
Thank you. Fayyaz, we know amongst the Pakistani community that the uptake, both nationally and sometimes locally, has been not where we would like it to be. Why do you think that might be?
So I think there are two factors. One is the information may not be available in the local language, and some of the older people may not be able to understand what's the vaccination program has to offer. And secondly, in Pakistani and all other communities, there has been a lot of misinformation, but luckily that is getting better. And I would recommend people to rely on information from reliable sources such as NHS, World Health Organization, WHO, or CDC, Center for Disease Control.
Fayyaz, you talk about misinformation and myth. One of the areas of misinformation I've heard about that maybe you could help clear up is that some people are concerned the vaccine is not halal.
Yeah, that was a misconception, and that was on the social media, but it has been very clearly stated that it does not contain any pork or any non-halal product. It is given freely in all the Muslim countries, Pakistan, UAE, Saudi Arabia, and all the religious scholars are united that people should take the vaccine and it is halal.
Fayyaz, if you would give one message to the healthcare workers out there, what would that be?
I would say life is precious and we should protect it. It is our social and religious duty to protect life. If you have taken the vaccine, you're a hero. Just tell everybody around you to take the vaccine. If you missed the dose, dial 111 or NHS website to rebook your test. So get the vaccine, stay safe, and stay blessed.
And a more personal message to the community?
The personal message, just safeguard your adults, your parents, grandparents. The Pakistani community is a family-loving community. They've got the elders with them. So protect them and just get the vaccination done ASAP. Please vaccination कराएं अपने लिए भी और अपने खानदान के लिए की हिफाजत के लिए भी.
Thank you so much, Fayyaz.
You're welcome. Thank you.
I hope you found that informative and helpful. I was joined by multiple colleagues from multiple different backgrounds, all of whom have had the vaccination and all of whom are really making the case for you to go ahead and be vaccinated if you haven't been. This is the way we're going to fight the condition. It is the way we're going to get our liberties and freedoms back. We've really been confined for a long time, and our lives have been turned upside down. This is part and parcel of our way out of this, and as you saw, most people were able to address the many myths that are associated with the vaccination, and I would urge each and every one of you to go out there, if you haven't been vaccinated, and get the vaccine done. Many thanks.